Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pulmonary artery hypertension, and that is PAH, and we're looking at the drugs which are involved. So first is we look at the prostacyclin derivatives. So this is the prostacyclin derivatives. So prostacyclin derivatives, it includes the epoprostenol. So this is epoprostenol. Next is the iloprost. So there is the iloprost. Then comes the treprostinil. Next we move on to the endothelin receptor antagonist. So endothelin receptor antagonist. So here there is bosentan, ambrisentan, as well as the macitentan. Next heading we will be looking at the PDE5 inhibitor. So PDE5 inhibitor, it includes the sildenafil and the tadalafil. Sildenafil as well as the tadalafil. Then we move on to the soluble guanyl cyclase stimulator. So soluble guanyl cyclase inhibitors, cyclase stimulators. So this includes the riociguat. Lastly, we look at the calcium channel blockers. The calcium channel blockers, it includes the nifedipine, diltiazem, as well as the amlodipine. To learn and grow daily like this, please do subscribe.